Welcome back to the Children's Health Technology Conference 2023. Thank you so much for all of your comments, all of your questions. We're getting some wonderful feedback about all of the speakers today, so please keep those coming. Please keep putting those in the chat or tweeting or using the hashtag CHT 2023 on social media, and we'll pick those up and make sure that the speakers are asked as many questions as we can possibly get through. Having said that, unfortunately, the next session doesn't have a Q&A session, but I am delighted to welcome a series of abstract presentations, the first of which is going to be David Hutchon, who is from Sheffield Hallam University and also Sheffield Children's Hospital, NHS Foundation Trust. And his abstract is entitled "A Hands-Free Neonatal Doppler to Determine the Heart Rate Immediately After Birth."
We are pleased to present a novel, hands-free neonatal device to measure the heart rate of the baby immediately after birth. We are using a modified fetal heart rate device. The heart rate is considered the gold standard for the health of the baby immediately after birth. If the heart rate is below 100 beats per minute, there may be a need for resuscitation. It is vital that this measurement is done accurately to avoid the unnecessary harm of early cord clamping if the baby has to be removed to a room-side resuscitator. Current methods of measuring the heart rate immediately after birth are suboptimal. Auscultation is the commonest method at present, but it lacks accuracy, can only be heard by one person, who needs to be watching a clock and counting at the same time, and then requires a degree of mental arithmetic. There's no documentation of the heart rate for future review or audit. Peripheral circulation is initially poor immediately after birth, so oximetry does not work during the first minute until the circulation has improved. The ECG is not widely available outside specialist units. It requires the application of 2 electrodes, and the machines are relatively expensive. It is the gold standard for a heart rate, and it is documented in real time. However, in a very sick baby, there is the possibility of a false result on the ECG due to pulseless electrical activity of the heart muscle. Pulseless electrical activity of the heart was actually identified by the use of Doppler ultrasound. For over 50 years, ultrasound has been used routinely to measure and document the fetal heart throughout pregnancy and during labour. Before birth, Doppler works well through the maternal abdomen, and quite recently it was found to be effective after birth on the baby's chest. Doppler ultrasound has established efficacy for determining the heart rate and has gained safety assurance during millions of pregnancies worldwide. 5 recent studies from around the world, from the USA, Japan, India and Italy, show that a fetal Doppler works well on the baby's chest immediately after birth. And these studies found that it often provides a result quicker than the ECG. All these studies used a standard fetal Doppler. The fetal Doppler needs a directional probe to locate the fetal heart inside the maternal abdomen. However, after birth, we know exactly the position of the baby's heart. We've developed a modified fetal Doppler, removing the transducer from the handle of the probe and connecting it with a soft wire, flexible wire. This can be now placed on the baby's chest just like a stethoscope. The lightweight transducer connected with the soft flexible wire can rest unattended on the baby's chest simply by the surface tension of the thick ultrasound gel. The device is now hands-free, leaving the neonatologist free to provide other necessary care. The typical Doppler sounds can be heard by the obstetricians, the midwives, the parents, and the neonatologists. Fetal Doppler machines are readily available even in low-resource birth settings. It would be quite simple for manufacturers to make a multifunctional Doppler device with the transducer of a standard fetal Doppler detachable so that it can be used hands-free on the baby. It is a low-cost device which can be readily available in low-resource settings, and it works well immediately after birth, even in the compromised baby. It can also function through a sterile sheath at caesarean section. Obtaining and documenting the heart rate at emergency caesarean section for fetal distress is a particular challenge. We are carrying out a clinical feasibility study of the hands-free Doppler on healthy neonates at Sheffield's Children's Hospital. These babies have their ECG heart rate recorded as part of the sleep study. Ethical approval by IRIS was obtained for the study. The parents who were present during the Doppler study were asked their opinion of the use of the device on their child. The Doppler sounds were heard as soon as the transducer was placed on the baby's chest. These sounds were familiar to the mother, being similar to the fetal heart sounds. Six babies have been studied so far and show a satisfactory clinical correlation of the heart rate during the 5 minutes application. The typical Doppler heart sounds were heard immediately the transducer was placed on the baby's chest over the heart. The Doppler heart sounds and digital display were maintained over about 5 minutes. The displayed heart rates are transferred wirelessly to a nearby computer and time-stamped for comparison with the ECG heart rate. These two graphs are typical of the results so far. The results of the parental survey were encouraging. None of the parents considered that their baby had experienced any distress or discomfort from the transducer. The mothers could all recognize the heart sounds from their recent pregnancy experience and found the sound of the heart reassuring. They all thought it was superior to a doctor listening with a stethoscope. In all babies, the device remained reliably on the chest, held in place with the ultrasound gel. One baby was making significant movements, but without disturbing the transducer. Neonatal life support and NICE guidelines emphasize that the baby's heart rate must be determined at caesarean section during the 1 minute delay after birth and before clamping the cord. The baby is within the sterile field, and sterilization of a stethoscope, oximeter, or ECG is just not possible. However, the Doppler transducer can be placed inside a sterile polythene sleeve and functions well through polythene. This will be the subject of a future study.
Thank you so much to Dr. David Hutchon for that great abstract, and really looking forward to seeing what happens next in his research.